Hi, thanks. I'm Leah Dean. I'm a political scientist and a research associate with the Institute of Policy Research at the University of Cincinnati. Unfortunately, Eric Rademacher is very sick today, so you got just me. I'll be discussing data from two surveys, the Kentucky Health Issues Poll and the Ohio Health Issues Poll. We'll be looking back at around 10 years worth of survey results from both studies and what those two studies can teach us about policy and survey results sort of moving forward. Do I know how to work this? All right, cool. So, a little bit of background on IPR itself. It was founded in 1971. We conduct complex, large-scale surveys using a variety of data collection methods, phone, web, in addition to focus groups, in-person surveys, direct observations. IPR was actually a pioneer in random digit dialing, RDD, telephone techniques for conducting scientific surveys of public opinion. Both of the surveys we're going to be talking about today are RDD telephone surveys. So, as I said, the focus will be on two of our long-running RDD telephone surveys. The Kentucky Health Issues Poll, which began in 2008. It measures Kentucky adults' opinions on a variety of health topics. It's a statewide survey design, meaning that we call adults on their landlines or their cell phones across the Commonwealth of Kentucky. KHIP actually oversamples 5 regions of Kentucky: Western Kentucky, Louisville, Northern Kentucky, Lexington, and the Appalachian Area Development Districts. That sort of allows us to do a more in-depth examination of all 5 regions of Kentucky. Since KHIP was started in 2008, we've interviewed a total of 17,876 Commonwealth of Kentucky residents. The 12th KHIP is currently in the field right now, and that project is jointly funded by Interact for Health and the Foundation for a Healthy Kentucky. The Ohio Health Issues Poll is also a yearly study, began in 2005. Same thing, measures opinions on a variety of health-based topics. It is also a statewide survey design, but we don't have the same oversample that we have on KHIP, so it's a little bit harder to look at regions of Ohio specifically. And since 2005, we have interviewed 12,477 Ohio residents, and that project is funded by Interact for Health. And I forgot to mention, in terms of questionnaire design, KHIP and OHIP are both designed in partnership with others. KHIP questions are designed by the Foundation for a Healthy Kentucky, Interact for Health, Community Input, and IPR. OHIP questions are designed in partnership with Interact for Health, Community Input, and IPR. So, what does the data look like? One of our longest running questions is general health rating. We've asked it and we continue to ask it on nearly every telephone survey that we field. Why do we ask it? It seems pretty rudimentary, right? It's actually a good measure of health of the population. It's used by the CDC and Healthy People 2020 as a benchmark for national health. Healthy People 2020 describes it as validated as a useful indicator of health for a variety of populations. It's a really good indicator of health as it relates to age as well. So would you say that in general your health is excellent, very good, good, fair, or poor? So, general health in Ohio, which is the gray line, and Kentucky is the red line. So here's where you really start, well, before I get into that. Last year on KHIP, we were at 40.1% of adults who said their health was either excellent or very good. In Ohio, we were at 44.3% of adults who said their health was excellent or very good. As a national comparison, the 2018 Behavioral Risk Factor Surveillance System, survey, said that the median prevalence of excellent and very good health nationwide was 50.6%. So a little bit under, but still pretty good. So here's where the oversamples in Kentucky provide us a really interesting look because we can deep dive into all 5 regions essentially at once. As you can see, it really varies from region to region. You've got Lexington and Louisville and Northern Kentucky, bit higher than when you look at Western Kentucky or the Appalachian Area Development Districts. So the percentage of those reporting no insurance or the uninsured rate. It's declined pretty heavily since 2014. Might be due to the implementation of provisions of the Affordable Care Act, Medicaid expansion, marketplaces, things like that, that really started to get going in 2014. KHIP, as of last year, was at 8.9% of those who reported no insurance. Ohio was at 10.3. Weird little uptick in Ohio for 2018. We think that might just be a weird blip because as of 2019, the rate fell to 6.2%. All right, so KHIP and OHIP both ask questions about the abuse of prescription pain relievers, the use of heroin, and the use of methamphetamines. I'm gonna be focusing mainly on pain relievers and heroin today. We just have a little bit more data on that than we do for meth. We've asked these questions pretty consistently on KHIP, a little bit less consistent on OHIP. What you'll notice when I get into these two questions is that we ask it based on family and friends. So historically, that's a hard question to ask people, right? A stranger calls you on the phone and says, hey, let's talk about your heroin use. You're probably not gonna answer that question. So what we ask is, do your friends and family members have an issue with substance abuse, such as heroin, methamphetamines, pain relievers? It's a proxy for what that rate looks like as a whole, but it's also sort of gets at the degree to which substance use has impacted people that are close to you. So, first one we're going to be talking about is heroin. There are fewer Kentucky residents who report friends or family members who have experienced problems with heroin. The proportion of people who report someone who's had a problem with heroin has continued to climb a little bit, not super great, but we're looking at about a little over 20% for Ohio, right at about 20% for Kentucky. Pain relievers. It's always been a little bit higher in Kentucky than in Ohio, the exception being 2015. So this one's a little bit confusing, which is why I've highlighted 2014 and 2018 here. It might be that results of friends or family members who've had a problem with this is just up and down over time, and that's just sort of the nature of what's going on here. What might also be happening is that, unlike the heroin epidemic, which has been receiving attention since about the 90s, the association between drug abuse and doctor-prescribed medication is a little bit more recent, right? So people it may be that what's happening here is people have started to see the use of prescription medications more as abuse and not as, well, I just take a lot of Vicodin every day and that's just like how I live my life. So that might be why you sort of start to see an uptick, and that might be why this chart in particular feels like it's a little bit all over the place. Smoking, okay. So KHIP and OHIP have asked and continue to ask questions about the use of e-cigarettes, cigarettes, and tobacco policy. I'm gonna be talking mostly about current smoker and statewide bans on smoking in public places. KHIP and OHIP always track the number of current smokers over time. KHIP has also asked about a statewide law that would ban smoking in public places. As of 2018, there are 26 states that have statewide bans. Kentucky does not have a statewide ban, but 37 of its localities have a statewide ban, so we'll get into that in a little bit. Okay, so we base current smoker on the combination of two different questions. Have you smoked at least 100 cigarettes in your life, which is essentially 5 packs of cigarettes? And do you smoke cigarettes every day, some days, or not at all? Current smokers are, you've smoked at least 5 packs of cigarettes and you smoke them at least every day or some days. As you can see, a little bit less data in Ohio than in the Commonwealth of Kentucky, but that's okay. We're sitting at about 23% in both states right now. It's really started to fall off in Kentucky, as you can see. This is another place where we can do a deep dive on all 5 regions of Kentucky. So, across the state, higher in the Appalachian ADDs and Western Kentucky, lower in Louisville and Lexington, kind of a little bit lower. What might be happening here is that Louisville and Lexington are places that have smoke bans already in place, right? So they may be looking at just lower rates overall. Let's see, smoking in public places is something we've tracked over time as well. You can see that as the current smoking rate falls off, the rate of smoking in public places also continues to fall off, continues to increase in terms of support for a law that would prohibit statewide smoking. Okay, I'm gonna be quick because I could talk your ear off about the Affordable Care Act. It was my dissertation topic. So, you're all probably familiar with the Affordable Care Act, passed in 2010. Most major provisions took effect in 2014. Kentucky, Medicaid expansion, but also their own marketplace. Ohio expanded Medicaid, but that was it. We've been asking those questions since 2010. In terms of information, the longer the law is in place, the more people have a better understanding of how it impacts them personally. It's just how status quo works. In both states, that continues to happen. It'll probably continue to uptick as we go forward. The Affordable Care Act. Okay, so the other thing we ask is, do you favor or oppose the Affordable Care Act? I think it's actually, do you have a favorable or unfavorable opinion? So again, status quo effect here a little bit. The longer the law's in place, the rate of support continues to rise a little bit. It's about the same in Ohio and Kentucky, but I do want to point out that this does not include don't know responses, which are about 20% across both states. So while support looks like it's doing pretty good, there are a lot of people who just don't know what their opinion is. Favorable views nationally, we're at 51% as of October 2019. Obviously, there's a lot of variation by party ID. Democrats are at 81% reports of favorability. Thanks, Aaron. And Republicans are at 15%. So, if you're interested in more information about either poll, you can find that on Interact's website or on the Foundation for Healthy Kentucky's website. And we always like to see community input in terms of the questions, what we're asking and things like that. So you can do that on Interact's website by talking to Susan Sprigg, or you can do that on the Foundation for Healthy Kentucky's website. They have a great little submission form that you can fill out there. Thanks.